Hi everybody, this is Siegfried Trent, and this is my video series, What Do I Think About... And today's topic is, what do I think about healthcare in the US? Wow, it's a scary topic, but thank you very much, Tracy, my friend, for providing me with this topic. I'll do my best. This is like a 10-minute essay, that's what I shoot for. I'm going to try to cram things in. So, incredibly complicated, and I think every decision made with healthcare, life is on the line. We are weighing people's lives, and we are looking at costs, and we are looking at feasibility and many other things. So it's very difficult. Anybody who says they have easy answers is wrong. And what I say here is not some kind of panacea that's going to solve the world's problems. They're just my thoughts about the challenges we face and some of the directions I think we should move in order to try to solve them. This is not a detailed plan. It's just general directions. First, let's take a look at some of the things that I want to see in healthcare in the United States. So, number one, I want high quality care. So I want people to be able to prolong their lives, live healthy lives. I want new technology to solve diseases and problems that people have, both to make it cheaper to solve the older ones and to solve things that we can't solve now. Yeah. Number two, I want it to be widely available. So I want as many people as possible to benefit from the healthcare system. I don't want anyone just sitting at home and sick and dying because there is no recourse for them, no way for them to get any kind of care. I want relatively universal coverage, although I don't think you can ever get to 100%, but we'll do our best. Number three, reasonably affordable. It can't be too expensive. If we want to cover everybody and we want to get good quality, we're gonna have to be efficient. We're gonna have to make some hard choices and sacrifices, right? So these are the three things I want: high quality care, widely available, reasonably affordable. All right, moving on. Let's look at 7 big challenges. These are not the only challenges, but there are many, many, many in healthcare. But these are 7 that we want to take a look at and I think are important to think about. Number one, healthcare costs money, and yet we think health is priceless. We are in a constant dilemma. What will we pay for our loved one's life? We will pay almost anything is the answer. And yet, if we're designing a public system, if we're looking at overall how we're supposed to deliver healthcare, there are going to be costs, there are going to be hard choices, and there's no way around that. And so it's something that we have to wrestle with. And no system will be perfect and will make everybody internally happy. All right, number 2, technology, standards, and expertise. So basically research, regulations that we put in place, and the expertise of doctors are all things that drive up the cost, right? These are all wonderful things. They are good for the quality of care, but they also make it more expensive. So this is something that we need to try and find the right balance and mix for. Number 3, if we limit price, we will reduce supply. So if we put caps on how much we can pay for healthcare, we say, oh, it can only ever cost this much, you are going to reduce the supply of technology, the supply of innovation, the supply of doctors, the supply of facilities, the supply of equipment, etc., etc. These are basic economics in a capitalist system. What are you going to do? Even if you say, oh, we're going to privatize it, right? But you can't privatize everything that healthcare touches. It touches so many parts of our lives: contractors, builders, property prices, wages, insurance costs, office supplies. The list goes on and on. You can't just put everything under one monolithic control. So you're always going to have a balance there with cost and supply. Number 4, insurance hides pricing from decision makers. So we, the individuals, tend to make most of the healthcare choices. The doctors help a lot. The insurance is the main way that most Americans are paying for their healthcare, and yet the insurance hides from us, the consumer, how much the healthcare costs. It encourages some deception by the providers in the hospitals to say, oh, it's going to cost more, and then the insurance pays. The insurance companies push back. It's a convoluted system, and the people who are making most of the healthcare decisions, us consumers, don't really understand how much these things cost or what we're getting for our money. So the doctors and the providers and the for-profit system are encouraging us to get lots and lots of care for the very, very, very best health possible. But how much is it costing us, and can we afford it? And what about the other people who are on the insurance program? It's very complicated. All these things are hidden, so it's hard to make good decisions. Number 5, insurance can't support pre-existing conditions without a universal mandate. So the problem is, if you already have cancer and you want to get medical coverage for that cancer, insurance doesn't make any sense. Insurance is to spread the risk, future risk of damages, out amongst a large portion of people. If you already have a condition that's going to cost incredible amounts of money, insurance doesn't want to cover you, and it really can't without raising everybody else's price in order to pay for what you're bringing into the system. You're not spreading risk because it's not risk anymore, it is a known cost. Same thing goes with insurance providing, say, preventative care, which you would think it would be great for insurance to provide preventative care. But if you think about it, everybody pretty much would have the same preventative care costs. Insurance is about evening out risks. If you're just paying your insurance company to pay you back for a yearly checkup, you're not really saving any money. You're just adding administrative costs to the cost of your yearly checkup. So it's really not a good system for preventative or regular maintenance care. All right, next up, profit-based healthcare encourages overutilization. I talked about that a little bit, and discourages low-income clients because they're not as profitable. The margins aren't as good. Hospitals, often they need money from Medicare, but they don't really like it because it doesn't pay as well as private insurance does, et cetera, et cetera. So the profit-based system has some real problems and incentives and tensions. But at the same time, profit-based system and competition has a lower pressure on prices in some other ways. And it has some other benefits, right? Because there's a lot more innovation and this sort of thing. So it has its benefits, it has its costs. Number 6, the population is aging in America, around the world. In Western Asia, this is a huge problem, but it's coming everywhere. Populations are aging, we are having less children. This is the result of various economic effects that are going on in society and social progress changes. It's a danger for the medical field because that means more of the population needs intensive medical help and less of the population is highly productive and doesn't need the medical help. There is basically a wealth transfer that happens with the healthcare business and industry in a sense. Now, ideally, people save up the money and then they use it then, but it doesn't always work that way, especially when you have a public system. So we have this big problem of demographics. Next, 7, it's hard to reward good health without punishing people who are sick. Do you want to punish people who are sick? Oh, you are very unhealthy. We won't take care of you now. That kind of goes against the whole idea of the system. Sick people are the ones who need help. But on the other hand, you want to reward healthy behavior and make people behave well because that's the most efficient way. If you just maintain good health, we save tons of money and you are more happy, right? So that's great, but it's a very hard thing to incentivize. Okay, so these are 7 big challenges that we have. How do we solve them? I'm not sure. But here are some ideas I have, ways that I think we should move in a direction. All right, that was pretty vague, but here we go. Number 1, a public system that provides universal basic coverage. And I do mean basic. We'll talk about that a little bit more. But I'm not talking Cadillac coverage, the very best available. I'm talking if you get sick, you can see a doctor. If your child is sick, you can see a doctor. You can get medication. You get medication for your diabetes, for common problems that people have. You don't have to worry about whether or not it can be taken care of. If you have an incredibly exotic sickness and it's going to cost millions and millions and millions of dollars, well, maybe we don't completely cover that because we can't afford it. All right. A very small percentage of people make up the vast bulk of healthcare costs. It's kind of a problem. Now, part of it is we're going to spread that out amongst many people, and that's okay. So we can afford the peaks and valleys, but there are some extremes that are maybe too far for a public system to handle. And we're not talking about Cadillac care where you get the very best of everything. You'll never feel the shot. You'll never even know that you had surgery. Yeah, I'm sorry, but we're going to have to be cost efficient, and some things are not going to be as good as they could possibly be because we need to save money so that everybody gets something. All right. Number 2, a private system alongside this provides premium and luxury coverage. Right? Both because that's going to provide a lot of innovation because it's a market that's going to drive through a lot of money. For rich people can have what they want and they can have better health coverage because they're wealthy, just like they can have better cars and better houses. We're still going to provide basic stuff for people, but there's going to be an ancillary system where if you have extra income, you can get even better coverage and you can, kind of get what you want. Even the things that the regular system doesn't cover that we would consider medical luxuries, basically, which there's going to be more and more of as we go into the future. All right, next up, kind of a public charity system. What's a public charity system? Well, if you think about the way like GoFundMe works, a lot of people who get into serious medical trouble start up a GoFundMe page. This would be a sort of a universal GoFundMe. It's not for profit, so it doesn't make any extra money. It's just a public system by where people who are in the public healthcare system, which is everybody, are able to appeal for private charity and get some of their costs subsidized if they have really special needs. And also, well, we'll get into more details on how it works later. So let me do this first. The public system. So it provides a baseline of healthcare through private and public network of care facilities. So it's publicly funded, but it's actually implemented through a network of both private and public institutions. Everyone is enrolled in the system. It's universal in the United States, especially for citizens. For qualified immigrants, people who are here legally in the country, it would also apply as well. Funding. General tax. So I believe generally tax policy, the government taxes some money and then decides where to spend it. So it would be largely funded by that. Special taxes on unhealthy products. This is a way to discourage bad behaviors. So, sugary foods, excessively fatty foods, basically treats and desserts, cigarettes, alcohol, other drugs that are made legal, since I tend to believe in legalization. Things that we know have a severe negative health impact. These things will fund into the health system and discourage their use to some degree, thus punishing a little bit people for bad behavior, not for being sick, but for behavior that leads to them being sick. All right. Finally, we have progressive co-payments. So people who are wealthy, who are using the public system, they have a series of co-payments that they have to make that kind of rise up in the upper income levels. This way, it's not a barrier to entry for anybody due to income, but we do recoup a little bit of the costs of the system for people who can afford to pay it and who are using that system. If they're using the private system, they don't pay these co-payments. All right, next up. Public services are based on a cost-benefit analysis, so the idea is we're looking for efficiency, the most bang for the buck, the most health for the least money. And so we're not just going to do everything ever possible for people's health. We're going to be smart about it and efficient because we want everybody to be able to get access to this. So next up, costs are transparent to the participants. So we need a system whereby, even if it's publicly paid for, people understand and can make choices about what kind of services they're doing. And this comes with another caveat, is caps. So there would be a yearly cap on the amount of baseline expenditures. This would be for preventable health care and stuff, plus a fair amount of an extra ceiling for things that we don't foresee, emergency visits, things that people normally encounter. And that's kind of a yearly cap. Now, everybody can get access to the yearly cap, no matter, it doesn't have a lifetime limit. Every year, you're kind of allocated this much money that you can spend before the system starts to cut out, and you have to rely on the private donations, or you have to use your own insurance to cover the rest. Next up, it has a kind of a lifetime catastrophic limit. So there is an upper limit to the amount that can be spent on one person subsidized by the public system. Again, this encourages both doctors and patients to think about the most efficient path of care for themselves, so they don't run out of coverage and they don't overuse the system, and so that everybody can continue to get the healthcare, right? We don't want to crash this thing. Next, loans are available, at-cost loans from the government, because the government can pretty much kind of manufacture money, more or less. But we'd like to recoup these in order to keep a balance. So people can take out loans for the excess that go beyond the system from the government, and these need to be paid back. They can be paid back from estates. They can be paid back by relatives. There are various methodologies by which the money can return to the government. Maybe we don't get all of it, but we try to keep this just an at-cost system. So we can recoup these costs, but it still gives people some flexibility. Next, the private system, not publicly subsidized. So this system does not take money from the government thing, except when the government wants to pay for particular services, at which point they basically pay at rates that they've decided are more or less equivalent to their costs, maybe with some markup, but basically equivalent to their costs. Because we're not going to be able to build public hospitals everywhere, we have to utilize the private system as well. But in return for this, the private system gets pretty heavily deregulated so that they have more freedom, and there's some other means down below we'll talk about which are benefits for them, because we want the system to be healthy, we want it to be profitable, and we want it to be kind of vibrant like the one that we have already. But we do want the system to be able to care for public people using the public money without actually being subsidized, and those rates are set by the public system. So people can kind of hybridize, and they can use the public system to a certain extent, and then get additional coverage for these kind of private luxury care through the private insurance market. All right, finally, this charity system is designed to support special cases, so the funds can be raised to exceed coverage limits for private care or for private care, whatever people want to use the money for. It is freely donated, so they are kind of free to expend it on any kind of medical expenditures they want through the system. The funds can also go to public research grants, so the public can kind of get together and try to fight diseases and things like this. And they know the money is, tax deductible, and it's going to go straight without administrative costs or this. Those administrative costs just borne by the general healthcare system in order to facilitate this kind of financial movement and ability for the private market to come in and really support this public baseline, right? And I think this allows for the system, even though it has a baseline, to kind of have a flexible upper limit to how much it can provide through these mechanisms. All right, finally, just some miscellaneous ideas. Limiting liability for malpractice suits is a bit of a drag on both the private and public system. I think there needs to be limitations since we are encouraging baseline care. If you do have some kind of problem with malpractice, there will be public funds that are freely available to you in order to get taken care of. So that eliminates part of it. And the penalties, the idea that we need to use these lawsuits in order to penalize organizations for providing healthcare, I'm not sure I like that so much. I think if they really need to be penalized, it should be at a criminal level. And so if they are criminally malpractice, then that needs to be prosecuted. People need to go to jail in addition to paying fines. All right. Deregulation for specialized lower skill practitioners that provide services. What does this mean? Doctors have to go to school for an incredibly long time in order to get to their level of expertise. I think we need ways for people to get like a 2-year degree, but provide certain levels of medical service. How advanced do you have to be in order to see people for influenza, right? To administer shots and to provide advice and basic medications, right? Our system is kind of rigged up to really push everything through hyper specialists, people who have incredible amounts of training. And while that's nice, if we're going to try to maximize efficiency, we need to have these different gradations and to have people who can provide medical services without such extensive costs and legal liabilities and all that sort of thing. So I think we need to think a lot about that. Deregulation of some pharmaceutical products. I think pharmaceuticals are a little bit over-regulated. I think it needs to be easier for people to buy them, easier for people to get access to things. I know there are some risks when it comes to addiction and some other things like that. But look, at some point you have to take some risks in order to get some efficiency. You have to give people some individual choices. So I think that's kind of important. Finally, not quite finally, deregulation for online and telemedicine services. I think these are incredibly efficient. Our infrastructure is growing, so more and more people can have access to it. I think often for lower income people, access to a cell phone is easier than access to a car in order to drive to a facility. So being able to get telemedicine services universally in the United States, I think is incredibly important. Last point, we need some kind of interstate treaty on insurance policies and medical regulations so that if I have a phone in Ohio, I can call somebody in Washington State and get medical advice if that's available, or I can go on the internet, talk to somebody in New York State in order to get medical advice. It's going to make the system more efficient. Right now, state regulations and boundaries prohibit this kind of thing, and they make insurance not portable from one state to another. There's all kinds of challenges and difficulties with that. We need some kind of, and the Constitution prohibits the federal government from just mandating these things. We need some kind of interstate treaty where all the states get together and they agree, look, in order to make the system better, we're all going to cooperate. We're going to come up with some standardized rules so that people can get health in America no matter where they are. All right. That's a lot of stuff. Are all those things easy to do? No, not at all. But these are the directions that I think might be useful or productive in trying to improve the system. All right. Well, I'm Siegfried Trent. That's what I think. Thanks again, Tracy. If you have any topics you'd like me to discuss, please leave a message below. Let me know what you'd like to see, and I'll do my very best to tell you what I think. Good night.